Welcome. You're listening to Ask the Doulas, a podcast where we talk to experts from all over the country about topics related to pregnancy, birth, postpartum, and early parenting. Let's chat.
Hello. This is Kristin Revere with Ask the Doulas, and I am thrilled to chat with Dr. Jennifer Lincoln today. Dr. Lincoln is a board-certified OB-GYN who is passionate about helping women understand their bodies and feel empowered to advocate for themselves. She practices as an OB hospitalist in Portland, Oregon, and uses social media to educate and advocate. Dr. Lincoln is an author, media contributor, and past president of the Society OB-GYN Hospitalists. She received her undergraduate degree from Washington College, her medical degree from Tulane University School of Medicine, and completed her residency at Oregon Health and Science University. Her second book, The Birth Book, An OB-GYN's Guide to Demystifying Labor and Delivery, was just published in March of 2026 and is available for order now on her website, drjenniferlincoln.com, or wherever you get your book. Welcome, Dr. Lincoln.
Thanks so much for having me, Kristin. Excited to chat with you today.
So thrilled to have you here. And our topic today is the reason I reached out to you originally on social media is all about vitamin K. And I feel like our listeners on Ask the Doulas and my students in childbirth classes and birth doula clients have so many questions about newborn procedures. So would love to get your thoughts on vitamin K and all of those early procedures that happen in the hospital.
Sounds good. Let's talk about it. In general, an OB hospitalist or an OB-GYN hospitalist, some of us do both, some just do the one. We are hospital based. So we are in the hospital. Somebody is there 24/7, 365. And it's becoming a model for obstetrics that's becoming more common for multiple reasons. But I think one that is the biggest reason why hospitals are going this route is that it's a real safety issue. If you have an OB-GYN who might be somewhere else and you're in labor,
right?
And they might be in the office or doing a surgery, or they might be home. And we, labor and delivery nurses are absolutely rock stars because labor is not predictable. Sometimes things happen quickly or there's emergencies. When you have a hospital, there's someone there right away. And so every hospital sets it up a little differently. And we also assist with triage. We help the other private practice docs out if there's emergencies. That's really our big thing. We go to all the emergencies. And we do this stuff like the doctor is at home and had a patient come in and just have a baby in 10 minutes and we're there. So we don't have an office practice, but yeah, so every shift is different, but I love it. And I think that you have to be a little bit of an adrenaline junkie to do it. But what I really enjoy about it is that we get to see the full spectrum from low to high risk. And every shift is a different adventure.
Yes, it's got to be. And in a lot of the hospitals that I work in as a doula, they happen to be teaching hospitals. So hospitalists tend to have a big presence. And that really sets the tone for future for the residents and students, nursing students and so on, to be able to work with hospitalists who are in full time. And
yeah. And for a lot of, like you mentioned too, and this is another big part, so I should highlight it, is we do a lot of that education. So if there are new protocols or new products, or we're doing simulation, we're usually the ones who are helping with that. When we do something all the time, let's say like a Jada, which is a device to help with postpartum bleeding when those were newer. And even still for some people who don't have a whole lot, will help the private doctors or midwives kind of get to feel comfortable with it. So I joke when I go into the room with a patient, I'm just going to be the doula for this Jada placement.
That is, and it's such an important role. So I know you have talked on social media about you had been on call as an OB in the past and really enjoyed the work in the hospital and not having to race to see a patient, as you mentioned, with a private practice. OBs who are on call for patients or have a shared call schedule for their practice and are at the hospital certain days and times. And so, it is fascinating. But as a doula, as my clients are talking about birth plans and those newborn procedures, having so many questions. So your book, the birth book, addresses so many topics that are important in planning for both birth and baby.
Yeah, I think the big part is that it's great to have these conversations and think about it before you've just had a baby, had your placenta, and somebody's leaning down and saying, can I give you your baby all the recommended newborn medications that we recommend? And if you have not thought about it or had a chance to ask questions, you might not feel this is the best time to do so. You're in love with your baby, you're staring at them, you might be getting stitched up from a tear. So it can be hard to have back and forth conversations. So I think these are great things to talk about long beforehand. And if you are choosing a pediatrician or a family medicine doctor to see your baby afterwards, this is a great opportunity to ask these questions if you're doing like a meet and greet visit, which I do talk about in my book, but essentially it's what it sounds like. You get to go see them and see if it's a good fit. But I think that it's becoming more common where we're seeing people declining some of these newborn medications, which typically include a vitamin K shot, a vitamin shot, and then erythromycin eye ointment and a hepatitis B vaccine. Those are usually the three that we think of. And we're seeing more people who are choosing not to use them. And no matter what I say, and this is my tone in the book, is like, you're going to decide what's best for you. So I'm just here to give information. The goal is not to coerce. It's just to give information and then you decide to do with it what you will. But what I think the reason we're seeing a lot more folks who choose not to get one or all of them is honestly a lot of incorrect information that we're seeing on social media. And I think at the end of the day, everybody's doing the best they can. We're all trying to be good parents. Nobody's saying, you know what, I'm going to try and make some really bad choices here. We all bring to it different things and we see different things. And when you have an algorithm that really figures out what to serve you, it can be really hard to tell what might not be accurate, what might be, and where to go next. So I think that having these conversations ahead of time, and I do go into detail in my book, so with references, because I think you don't have to take my word for it, right? Like on Reading Rainbow, they used to say. But I just wanted to provide information and you decide to do with it what you will.
Yeah. And having that evidence-based information, I feel like a lot of books on the market are cited to either pro-vaccine or anti, and having the evidence to make informed decisions as patients and consumers in healthcare is so important. So I am with you. And I feel like even with breastfeeding, everything is slanted in one way. So when I find resources like yours that are comprehensive and evidence-based, I'm going to refer those to my clients so they can make their own informed decisions.
Well, thank you. Yeah. I'm a parent too. And I can't remember if I share this in my book or if it was a different article. And my husband, who's a pediatrician, but with our first, I declined the hepatitis B vaccine at birth because I'm not sure if it makes sense for me. And now if I could go back and change it, I would have, because now I understand more of the public health perspective of it. And I think with our second, we got the newborn. I laugh, anybody who's having their second or third, like after the first kid, you're like, what did we do? You're just too busy. But my point is that I try to share the human side of it, which is that we all can know evidence and data. And still, when it's your baby, you have that feeling. And that's why I think it's really important to have people that you trust or sources that you trust that you can say, okay, I'm kind of having this feeling, but can somebody kind of help steer me in the right direction or steer me in a direction that I know is trusted and not based on misinformation or something like that. But I do get it. I totally get it.
Yes, agreed. And if a patient or client wants to decline, then they need to sign a form at the hospital. But as you mentioned, with the decisions, it's good to have that pediatrician meet and greet and some talk, because there's many practices in my area that if you aren't on track with vaccines, they're not going to accept you as a patient. So if you want to delay newborn procedures or decline, then you may not be a good fit for a particular practice.
Yeah, you and I could talk about that all day.
Hey, Alyssa here. I'm just popping in to tell you about our course called Becoming. Becoming a Mother is your guide to a confident pregnancy and birth, all in a convenient 6-week online program. From birth plans to sleep training and everything in between, you'll gain the confidence and skills you need for a smooth transition to motherhood. Live coaching calls with me and Kristin, tons of expert videos including chiropractic care, pelvic floor physical therapy, mental health experts, breastfeeding, and so much more. You'll also get a private Facebook community with other mothers going through this at the same time as you, to offer support and encouragement when you need it most. If you'd like to learn more about the course, you can email us at info@goldcoastdoulas.com or check it out at thebecomingcourse.com. We would love to see you there. We also have a book called Supported, Your Guide to Birth and Baby, which makes a beautiful companion to this course. It's a great book for any expecting mother and is the perfect baby shower gift. You can find information on that book at supportedbook.com.
I say this as somebody who truly believes that evidence-based vaccine schedule, the one that we have that has been the most well-studied, I truly believe that that is the safest and best thing to do for your kid. And I also think that babies who might not be on the same schedule or have vaccines, they still need healthcare too. And so my husband, who is a pediatrician, we're here in Portland, Oregon, where we do have some lower vaccination rates, which is unfortunate. We do see some increase. We see things pop up that probably wouldn't. But he said, Jen, we could choose to not see any of these babies, but also these kids are making this decision from themselves, right? They still deserve healthcare. Right. And it's based on the relationship and the trust that maybe over a series of a few years, you might feel that relationship with your pediatrician, like, okay, I trust them. I get that they're not trying to make money off of me, which I really want your listeners to know that pediatricians lose money on every vaccine they give. And I get it. Again, it's the algorithm is curated that way, right? Like it's just, you watch one video about something and then TikTok says, oh, they like that they stayed. So now we're going to serve you this and this. And it's just the system we're set up for. Pediatricians who are officially, as of this year, the lowest paid medical specialty, not trying to make money off your kids and vaccines. They would do well to instead become an orthopedic surgeon and make way more money doing hip replacement, doing child checks, which I laugh at, but I'm like, oh, our system is so backwards, but that is really the truth.
Absolutely. Circling back to pros and cons of vitamin, can you give us the full explanation of the benefits, why it's important to get it done in the hospital and not look at some of what I would consider the mom group discussions about alternatives?
Yeah. So I would say, and I have this discussion with my patients at times who are not wanting any of those newborn interventions or not sure. I would say, listen, out of the three that we've talked about, the vitamin K, erythromycin eye ointment, and the hepatitis B, I would really ask you to really deeply reconsider declining the vitamin K injection. Like if you're gonna give me one, let's do that one. And the reason is that vitamin K helps your blood to clot, and all babies are born with not enough of this, and they need the vitamin K to help their blood clot. And it doesn't matter if you're breastfed or formula fed or what your levels are or what supplements you take. It doesn't happen. And vitamin K gives them what they need so that they then can prevent these clots these bleeds. And you say pros and cons. There are no cons to vitamin K injection other than an injection might be temporarily, really briefly uncomfortable. But the pros are huge. And the injection, you might see in some of these moms group, they say, well, instead we'll do an oral series of vitamin K. And if you are on the internet, you'll see that in other countries, that's what they do. Other countries, however, we cannot compare those outcomes to ours because these are countries where they have excellent follow-up. And this vitamin K requires multiple doses, and that is not the same that we have in the US. And when you look at how well they prevent against these bleeds, the oral vitamin K is not as good at preventing the later bleeds. And you might say, what's the big deal? Like a little bleed, like a bruise? No, I'm talking about potentially catastrophic and fatal bleeds. Think of like a stroke in a baby's brain. And the babies who do bleed, when they lack vitamin K into their brain, 1 in 5 from them will die from it. And that is heartbreaking. And I wrote in my book, I said, you never hear about this because in our country, we have really good vitamin K acceptance rates. But unfortunately, even from my book, from writing it to now, we're seeing those rates drop. But a good article showing how these rates of these bleeds were increasing because these were parents who had declined vitamin K. And so when I say, we should have these discussions and you have the right to choose whether or not you want to give it to your baby or not, I just want to make sure that you are getting the right information and not because you have seen something scary. And I cover like the myths in my book about black box warning or that it causes cancer. These are all not true. And I can't possibly think as a parent of a greater regret and how I would even continue to exist if I knew that my baby had an outcome that could have been prevented had I had information that was accurate. So if you were thinking about declining vitamin K, I want you to think really hard about it. I also want you to know that if your baby needs a tongue tie, what's something called a frenotomy, where it's released, or circumcision, most pediatricians won't do it because they won't take the risk of something considered an elective procedure when we don't know if your baby is going to bleed too much. So it's a great conversation to have long before your baby is born so that you can feel like you're not rushed or pushed into a decision.
And that's a good point because you mentioned circumcision. So some clients think if they know the gender and they're going to have a girl, that wouldn't necessarily be something that would apply to them. But you mentioned the tongue tie or there may be lip ties or other ties to address. And my son had a tongue tie. So breastfeeding was painful. And I knew from having my daughter prior that it shouldn't. And so I had it addressed after birth and had my pediatrician look at it. And yeah, so that is certainly another factor. And I love how you cover tongue ties and all of the ties in your book as well.
No, thank
so
you.
much good information. Yes, I think that looking at all of the options. Now, when you look at other common newborn procedures, can you also give your pros and any potential cons that might be brought up in those mom groups?
Sure. So the next step would be the erythromycin eye ointment. And this is an antibiotic ointment that goes in your baby's eyes.
And it's so funny we're talking about this because just yesterday I saw somebody post that their newborn nurse had put this glue and glued their baby's eyes shut. And that's why their baby wasn't opening their eyes. And unfortunately, this poor woman, she got roasted in the comments and threads. And but this is an example of like, maybe this could have been explained better to her, right? Like your baby isn't opening their eyes because they just are 24 hours old and they're probably just sleeping. But baby, this is not a glue. It is not crazy glue. It is an antibiotic ointment to prevent or treat gonorrhea, which gonorrhea in the eye can cause blindness. And you might think, well, I was tested during pregnancy or I know we're monogamous. Like, why do I need it? And again, I hear you. I totally thought the same thing with my first pregnancy. And unfortunately, partners aren't always monogamous. Our testing isn't perfect, but your baby can also get conjunctivitis or inflammation of the eye from other bacteria as well, whether delivered by C-section or vaginally. And so it lowers those risks as well. But I hear you when people are like, what do you mean? I don't have gonorrhea. I'm like, I know. But you also have to think of this from the public health perspective of we do a much better job with doing things universally as opposed to targeted things, which we'll talk about with hepatitis B next. But it does have some potential benefits, especially for people, if it might be from another conjunctivitis. So again, it's not a glue. And the other thing too, for all of these things, and I want people to know this because I think that we don't do a great job of advertising this, I guess, in the hospitals, that this does not have to happen the second your baby comes out of your vagina. Like, babies out, weigh them and do footprints. And I've worked in a place like that before. And I was like, it was the baby assembly line because it was easier for the nurses, right?
Yeah.
Like you can check your boxes and you can hand everything off. But honestly, none of this stuff should happen until after the golden hour where you have that uninterrupted skin to skin with your baby. There is no rush. There's no time limit. So if you feel like, they're just going to rush, you can say, can we wait? And they should say yes. There should be no reason that they shouldn't. So I think that's helpful to know for some folks. And then
fortunate to work in many baby-friendly hospitals so that as long as mother and baby are doing well, there's a delay in any of those newborn procedures and the measurements and footprints, and it's all about bonding and attempting feeding initially. So,
yeah. And I do think that is becoming more common in places, which is great. So always have to feel like it has to be this battle. And then the last thing is the hepatitis B vaccine, which I do think a lot more people have heard about because certain governmental agencies have now said that they don't recommend it at the time of birth, which is a real mistake in my opinion, but also people smarter than me, like the American Academy of Pediatrics. And the reason here is that we know that giving a baby a hepatitis B vaccine, as opposed to waiting or only not giving it if you're negative in pregnancy, because we do test everybody. If we wait, we're going to miss a lot of cases. And hepatitis B, I've seen some people say, why do I need to vaccinate my perfect newborn who was just born against a sexually transmitted infection? And I totally hear you. But the point is that it can be passed from mother to baby. And then you might say, well, but I've tested and I was negative. You can acquire it later on and we might have missed it in your initial prenatal labs. But that's also only about 50% of newborn or your baby infections get passed. It can also come from a relative who has it and there's a cut on their finger and they put their finger in your baby's mouth to soothe them. We know that hepatitis B is so much more infectious than HIV. And when I try to calibrate it with that, I'm like, do you understand the level? Like this is what we're trying to prevent here. And hepatitis B can be far worse if you get it as a child. And before the vaccine was introduced, about 10,000 kids every year were infected from people other than their mother. So like that relative or a daycare provider or something like that. And hepatitis B can turn into cancer, which is just really not great. And so again, for all these reasons, we really do recommend that initial hepatitis B vaccine. But it's okay to have questions and great to ask these questions long before they're standing over you. And they're like, can we do this or not? What do you want to do? And I just think that it's really important to feel that you can get your questions answered and know that there are better places to get your questions answered than others that are more about facts than as opposed to fear mongering. So it's important to choose wisely.
Agreed.
Mm-hmm.
Wow, so much. So any other final tips for our listeners related to newborn procedures?
Yeah, I think that it's okay to choose to do them and to still feel sad if your baby cries with a shot or to still feel a little nervous. And I shared this on social media before, just like I shared with my previous story, when I was giving my oldest, when he was due up for his MMR vaccine, I 100% know that the MMR vaccine is not associated with autism. We have seen that debunked oodles of times, and the person who made that claim has lost their license. And still, because of what we see all the time and we hear on social media, you still go, oh, but what if I had done something? And I can understand as a parent that fear. And what I would say is you are only human if you feel that way. And it's because you love your child. And try to work with a healthcare professional or consult resources that don't play into that fear, but instead can say, hey, I know you're feeling this way, but let me show you this. Let me show you these numbers, and really try to trust them and not give too much play. And if you feel that there are certain social media accounts or groups that you're in that are causing you more anxiety and aren't like helping you feel more informed, they're just making you ask more questions, then that might not be a good resource for you. And you might want to curate your feed a little bit more.
So true. Fully agree.
Mm-hmm.
So how can our listeners connect with you, Dr. Lincoln?
You can find me on the internets, on Instagram and TikTok at Dr. Jennifer Lincoln. It's Dr. Jennifer Lincoln. I also have a Substack, which is going to take a slight hiatus this summer because I'm sure you get it. It's a little crazy right now this summer with kids and no school, but it's called the Birth Book Companion, and I put pregnancy content there. I also have a YouTube channel, and then my website, drjenniferlincoln.com, which I know you'll put in your show notes, but for your readers, in my book, I have a lot of checklists and questions that you can ask your midwife, your OB, your pediatrician, even questions about your hospital if you're planning a hospital birth, things beforehand. And if you want them as a printable PDF, they're all free, including a birth preferences PDF. You can go there and get them all for free. But if you want to get my book, you can get it there too. Yeah, and my book, The Birth Book, it's now available wherever you get your books. And it talks about doulas and what they are and inductions and postpartum. And so I just hope it's a resource that people find is the opposite of those social media groups I mentioned that make you feel stressed out. You can't sleep at night.
So helpful already. And I love that you also, it doesn't just cover the hospital birth experience. You also address home births and birth centers and all of the options that families have.
Yeah, no, I think that I wanted people to know that you're not going to read a book by an OB hospitalist and it's me yelling at you about why you have to come to my hospital. I mean, I love where I work, and I also know that we can do some things better. So I wanted to really help people feel that they weren't going to be shamed or talked down to if they chose a home birth. And I include the data about how for a lot of people, home births are great and actually have better outcomes. So stay tuned on whether or not I get kicked out of my OB groups, but so far, so good.
I appreciate you so much. And thank you for sharing your wisdom on all of the platforms that you're spending time on, as well as with patients directly, and especially in your new book, The Birth Book.
Thanks so much, Kristin. It's been great to chat with you today.
Thanks, Dr. Lincoln. Take care.
Thanks for listening to Ask the Doulas. For more information about Gold Coast Doulas, visit us on our website, goldcoastdoulas.com. We're also on Instagram, Facebook, and YouTube. If you like this podcast, please subscribe and give us a 5-star review. Thank you. Remember, these moments are golden.